Hi everyone, here we are again today at Conneaut Lake Vet, and we're going to discuss with Dr. Consla for our programs My Dog and Me, canine influenza, which is something that's been a concern to a lot of pet owners in recent months. So good morning or good afternoon, where are we, 11 o'clock, 11:30?
I think it's still morning technically.
And why are we in a different room?
Well, there apparently a transformer exploded or something, so we're in the surgery room where there's a nice window, so we've got some natural light.
Well, that's good, because we were trying to make a decision as to where we could do this. Okay, let's talk about it. What is canine influenza? So
canine influenza is an influenza virus or a flu virus that is particular to dogs. So we hear about the flu every year with humans.
Right.
You know, there's flu season, people get their flu shots, etc. You hear about swine flu, bird flu, all those types of things. All of those are just different forms of the influenza virus.
Okay.
And when it comes to the different strains, you'll see a lot of different names that we use to characterize them. So there's kind of big groups like type A, B, C, and so on. And then you'll probably always hear about like the two letters, H and N, and then they're followed by a number. So like, remember the big swine flu a few years back was like H1N1. Like, well, what does that mean? So that's a system that we use to categorize the different types of flu viruses. And H and N are just acronyms for two particular proteins that the virus has.
Okay.
And depending on the different strain of the virus, whether it's the different strains, you know, in a dog or a bird or whatever, those little proteins are different from strain to strain. So that's an easy way that we can kind of keep track of what virus is out there causing problems. How do we formulate a vaccine or treatment to a specific strain versus, you know, just kind of shooting in the dark.
Is that the same with the human, that every year that we get the flu vaccine and the flu shot, it changes a lot?
Exactly.
Okay, same idea here with this.
Yeah, exactly. Okay. So the flu that we might get this year is going to be different than the one last year. And, you know, they tend to stay in that big kind of subgroup, type A, B, or whatever, but those little proteins will change. And that's why the vaccine from the previous year isn't going to be effective, because it's targeting those, you know, specific proteins, whereas the one maybe we have next year, those change just a little bit. And so it tricks the immune system.
In canines, I'm not sure what it is with humans either, but with canines, is there any protection at all from the previous vaccine to the newest vaccine?
No.
Or do you really almost totally eliminates itself and you got to start over?
Right, we'll talk about that more in a little bit,
okay.
But exactly. So because the strain is technically a different form of that virus, any vaccine from the previous year or previous form or whatever
doesn't do any good.
Isn't going to do any good.
Okay, so is it here? Is it in Crawford County?
No. Fortunately.
That's good news.
Yes, it is.
Okay.
So the particular strain that we're dealing with right now is H3N2. And that's the same one. There was an outbreak in Chicago. I think it was in 2015.
Right.
You may have heard about that. And then the one before that, I want to say it was 2008, 2009, was H3N8. And that was down in Florida. So this current form of H3N2 started down in Florida as well, and has been mostly concentrated into the southeastern portion of the country. It has started working its way north, so that's why there's getting to be some more buzz about it.
Someone told me they thought it was starting, not to blame the dog show people, but it was coming up either with people from the summer that went down there in the winter and then came up, or a lot of the dog show people the dog show circuit changes quite a bit and they're traveling quite, you know. Because here I sit in little Crawford County. I don't think, I'm not that concerned about it, but should I be?
Yeah, so I think it started with some racing greyhounds, and then, you know, it kind of spreads from there. We'll talk about how it's transmitted in a little bit, but it's not, you know, particularly, you know, that racetrack's fault or whatever, but anywhere where you have a large number of dogs in a small area is going to be an at-risk population. And that's going to be very important for, you know, some of the prevention and stuff that we'll talk about. So in this racing greyhound facility, you probably have all these dogs, you know, moving in and out of the track. They're coming from all over the place. You know, the virus mutates, takes hold, starts causing disease. They start coughing and whatnot, and it spreads from there.
I know a lot of my friends do dog shows, and recently some of them have been kind of hesitant about going to a dog show because at a dog show you could have what, 250, 300 dogs there, and again they didn't want to go where there were so many dogs in one spot.
And that's, I think, just good sense. You know, we do the same thing. When it's flu season, you know, you're, you know, a little more cautious about where you're going, about washing your hands and all of that sort of thing. So, you know, the same thing applies to the dog.
Okay, what will I be looking for if, you know, as I said, I don't think my dogs have it or going to have it, but what are some of the signs?
Yeah,
of
so there's
influenza?
two forms of this disease that we see. One is a mild form and one is a severe form.
Okay.
The mild form is much more common, so we're talking like 50 to 80% of the dogs that get it. Roughly 50% will be exposed to the virus. Their body's going to make antibodies, they'll fight off the infection, and they don't ever have any clinical signs at all. Okay.
Okay.
So that's good. You know,
how would they know? How would the owner know?
You would never know.
Never know that the dog has it.
Never
Okay,
know.
Gotcha.
So, you know, again, it's just like, you know, some people. You know, everybody in the office has the flu except that one person. That one person was probably exposed to the flu virus, but their body was just able to fight it off for some reason. So, same thing with dogs. About half of them, maybe a little less, might be exposed. They might get the infection, but their body's going to fight it off.
And we probably wouldn't know that then. As a pet owner, it just happens.
Yeah. Okay. Like there's no signs or anything.
Okay.
Okay. So, you know, that's obviously the ideal situation.
Right.
So for the mild form, again, that's, you know, more common. That's, you know, roughly the other 50%. The severe forms are pretty small percentage, less than 10%. So the mild is going to be a dry cough. Sometimes,
like kennel cough?
Or a moist cough, excuse me.
Sorry, okay.
It can be a dry cough like kennel cough.
Okay.
Maybe some nasal discharge, maybe some lethargy. In general, the dog's probably going to be feeling okay, but just kind of have this annoying cough. That can last anywhere from 10 to 30 days. This cough.
Okay.
But typically they're still eating, they're still drinking, they want to play with their toys, they're sleeping, you know, they just have this kind of annoying
And that's
cough.
the main thing, is this kind of a wet cough?
Yep.
Okay.
Like I said, you can see some other signs, even with the mild form. A little nasal discharge, some sneezing, you know, maybe they have a mild fever or, you know, go off food for a little bit.
Okay.
But in general, it's just kind of that cough. That form of the disease tends to be self-limiting, meaning it's not going to progress into something more severe. If you ride it out, it's probably going to go away over time. Again, you know, similar to people with the flu. Most people get it, they don't feel all that great, but, you know, after a few days, they kind of rally, they're back to work. But there is, you know, those couple of people every now and then that it seems to hit extra hard.
Can it go from mild to severe?
Mostly
not?
Usually not.
Okay.
Usually they kind of get one or the other.
Okay.
Now certainly an exception to that would be, let's say the dog has a mild form of the disease and maybe it's just a little more aggressive, so they get some nasal discharge, a little inflammation in the nasal cavity, and then some of the normal bacteria and stuff there cause a secondary infection. That could certainly cause a more progression.
And in most cases, I as a pet owner probably wouldn't respond too much to this either. I mean, should I be concerned? Should I run to the vet right away?
And that's what people are talking about. So, you know, like when do you contact your
when do
vet?
I call you?
And so, you know, some people are arguing if you've been in an at-risk situation, so been to the dog park, the groomers, a dog show, a boarding facility, and, you know, 10 days later your dog has a cough, instead of just monitoring, maybe get it checked out sooner.
Okay.
Now, if your dog hasn't been exposed to any other dogs, and they were just out sniffing in the grass, and you just cut the grass, and maybe they inhaled a little dust or something, you know.
At this time of year.
Maybe watch it for a day or something. But a cough can mean a lot of different things, from heart failure to primary respiratory disease, all sorts of things.
Okay.
So, you know, in general, if it persists for more than a day or two, you should probably have it checked out. But if your dog has been in any of those situations, maybe bring it to the forefront of your mind.
Okay.
So the severe form, like I said, a very small percentage of dogs are
Have you seen
getting
any
this
of
form.
this?
No.
You haven't seen it yet. Are there any registered here in Crawford County that have been considered severe? Have you heard anything about that?
Nope, I haven't heard of any. There have been some people who have come up from the south who have dogs that have had a cough. And you know, it could just be kennel cough, it could just be a random upper respiratory tract infection. We treat it as, you know, potentially an influenza case, a mild influenza case, and basically we're treating it the same as we would a mild kennel cough case.
Okay, is there a sharing, this has nothing probably so much to do with this, but is there a sharing of information that if a dog goes to another veterinary clinic or something like that and ends up having the severe form of the canine influenza, is there any way that that's tracked? I know rabies and that's tracked by the health department for the dogs, but nothing like this basically is it?
Probably not. I don't think they're having us report it right now, but I mean, we're a small community, so people talk, you know, so if there was something, you know, usually everybody's calling each other saying, hey, you know, I had this case, you know, be on the lookout. Okay. Maybe it's here. And then usually, even though it's not, you know, technically reportable, you know, you would tell somebody of higher authority anyway.
So what's the severe?
So the severe form tends to be very rapidly progressing. So we're talking like 4 to 6 hours from like fine to like not doing well at all.
Oh wow.
And it tends to take the form of pneumonia. So increased respiratory rate, difficulty breathing, sometimes coughing up blood, very high fevers, like 104 to 106. 102.5 is the high side of normal, lethargic, not eating, clearly a sick dog, and very quickly.
Get to the vet.
Yeah. Now, the positive thing there is they tend to respond to treatment just as quickly as the disease came on. So within 4 to 6 hours, you should see them, you know, starting to turn the corner.
Wow.
And so, you know, that's a good thing. The key thing is, you know, just to get seen as quickly as possible.
Wow. Do those signs that you just said, the severe signs, are they the same for any other condition that a dog would have?
Yep. So any of this could really be applied to kennel cough. We see mild forms of kennel cough. Now that tends to be that more dry, kind of like barking cough, but there's crossover between both. You know, not every kennel cough dog has a dry cough. Some of them have a moist cough, and vice versa with influenza. So you can see a mild form of that where maybe they just have the cough, a little nasal discharge, and then I've certainly seen dogs with kennel cough that have full-blown pneumonia and need to be hospitalized, and they're very, very sick.
Okay, so the dog comes in, or the severe, although there are going to be these outward signs we're going to see, which you just said. Are there other ways to diagnose it?
So diagnosing is pretty tricky. There's two, when we're talking about finding like a virus in the blood, there's two tests we tend to think of. There's PCR, which is where the test is actually looking for like a little piece of the virus or the bacteria. So that would be like if that virus is floating around in the bloodstream, that test can kind of like grab onto a little piece of the virus and then flash positive. Because this is so new and influenza viruses are always changing, we don't really have a test that can do that very well. So that leaves us with the other big class of tests we have, which is serology, and that's looking for antibodies that are made to the virus. So there are some serology tests out there. I think University of Cornell has a good one that they've been using, and so that kind of gives us a number of antibodies which we try and determine, is it a previous exposure and the dog like fought it off, or is it, you know, high enough to be considered an active infection, or, you know, does the history and, you know, the clinical signs support even just a little bit of an increase. So those are the main tests we have for looking for the virus specifically. Other tests that we think about, and this is more, you know, if things are progressing or it's looking severe, chest x-rays to look for pneumonia, blood work to see how their immune system is doing, how the other organs are holding up, things like that.
Okay, so you said that the treatment is for the severe cases, let's see if I've got this right, for the severe cases, it can reverse itself pretty fast with the treatment. What is the treatment?
So for the severe form, we're talking about hospitalization, oxygen therapy around the clock, fluid therapy around the clock, and typically a combination of antibiotics. Now, antibiotics don't do anything to the virus, right? They only deal with bacteria. So basically, when they have pneumonia, some of the normal bacteria that are there start taking over because the flu virus damaged some things. So now those normal bacteria can get in and start causing problems. So the antibiotic deals with that, and you're still basically letting the virus run its course. So we call that basically supportive care. Like we're supporting the animal with oxygen because there's fluid in the lungs so they can't breathe. We're giving them fluids because they're breathing fast, so they're expelling more water in their breath. So we don't want them to get dehydrated. We're doing the antibiotics to help with the secondary infections.
Okay.
For the mild form, we try to avoid antibiotics because we don't want to promote any resistance if the dog isn't really that sick. So typically we're monitoring and doing like antitussives to help with the cough. Tussives. Oh. Anti-coughing medication.
Okay. You threw that little you threw that little fancy word in there. That tripped us all up there for a minute. Okay. What about vaccines? Is there anything else about treatment?
Well, yeah. Let's talk. I mean, that's the gist of treatment.
Okay.
It's mostly supportive. You want to talk about how it's transmitted?
Sure.
Okay. That can lead us nicely into vaccines. So it's transmitted through like saliva or oronasal secretions, you know, so think coughing, sneezing, those little particles get into the air.
Okay.
It does not survive outside the host very well. So if the dog has it and coughs and there's no other dog around to breathe it in, it's going to die pretty quickly in the environment.
It's not transmitted like by a water dish or something like that?
If there was saliva or secretions in the water dish, yeah.
There could be.
If like another dog came over right away and drank out of it.
How about toys?
Yep.
Is it extremely contagious?
Yes.
So if I have one dog with it, would I have to isolate that one dog?
Yeah, but typically by the time you find out a dog has it, all the other dogs have already been exposed.
Okay.
Because they don't start showing clinical signs till like 10 days after they get the infection. So you've probably heard like in people, you know, somebody will be sick at work and they'll be like, oh, the doctor said I'm not contagious because I'm already sick.
Oh yeah, right.
That's the same thing.
Okay, gotcha.
They were shedding the virus, you know, before they got sick. That's kind of how the virus works, because if a virus worked by it infects the person and it doesn't start shedding until they start coughing, then everybody would just isolate themselves and nobody would get sick, right? Well, if the virus is shedding before the person gets sick, then it infects a lot more people. So they're very clever little things.
Yes, they are.
And so typically, if by the time you think or are suspicious that your dog might have it, everybody else has already been exposed.
Talking about the contacts and just about the disease in general, the people that are coming up that were people that were down in Florida in the winter are
the snowbirds.
Yes, so a lot of the vets down there pushing the canine influenza vaccine.
It seems like they're talking about it more, and we're starting to talk about it more. You know, now that they're up here, getting ready to go back. The virus is pretty susceptible to most cleaners, like the quaternary ammonia cleaners, bleach-based cleaners, so that can be used in facilities. So I think they're taking those extra precautions, and that can certainly be done up here as well.
What if I'm going to Florida and I'm taking all 4 dogs with me next week?
Yeah.
Now, mine already have, we have to pretend because mine already have the vaccine. But if I'm going down, I've never done the vaccine. Would I be smart if I'm going down there and I'm going to be maybe going to a dog park down there or other people down there? Should I do the vaccines?
I think you should think about it. Now, if you only have a week, you're kind of out of luck because it's a couple of doses 2 or so weeks apart. So you need you know, at least, you know, a month, 3 to 4 weeks before they have immunity to it. So if you're thinking of getting the vaccine, if you're planning on heading down south, make sure you give some extra time so that immunity can develop.
Take effect. Okay.
So as far as vaccines go, we have 2 vaccines. We have the old vaccine for that H3N8 strain.
That must be what my dogs have.
That's what yours have.
Okay.
Now that doesn't do anything for this new strain because remember it had that little mutation and now it's H3N2.
Is there, let's go back, that one you just said that my dogs are vaccinated against, is that real active and is that big in this area?
It doesn't seem to be real active at this point. Some people, some of the specialists will advocate for if you vaccinate your dogs for kennel cough because they're in those types of situations, maybe they should be vaccinated for the influenza as well. Now certainly not everybody's doing that, but that's another way to think about it.
Well, a lot of people, and here we go back to our usual comment, if I come in here with, and I need the basic things for my dog, and I don't have a lot of money, and I don't know that I can afford that, is vaccinating against the old strains of kennel cough important, and should I do that, or can I probably say, well, you know what, my dogs stay home all the time, they're in the house, they don't go around anyone else, should they still do that vaccine?
Yeah, so it's not considered a core vaccine.
Okay.
So rabies and the distemper parvo combo, those are the ones that any dog should have regardless of what they're doing. If somebody came in and said they don't go to the groomers, they don't go to the dog park, they don't go to dog shows, etc., they're not boarding anywhere, I would say then they probably don't need that. If you want them to have the extra protection, that's fine, but they don't have to have it.
Is that almost like Lyme disease protection, the same idea?
That's also a non-core or lifestyle vaccine. So if the dog, now granted that's changing a little bit. If you watch the last program, it's even the little, indoor lap dogs are getting Lyme disease. But in general, we would say if your dog's not out in the woods or the tall grasses or, hiking or hunting or anything like that, they're not considered quite as at risk for Lyme disease. So do they need that vaccine?
And how often, 2 comments, how often do they have to be given the vaccine?
I believe it's once a year after the initial series.
I was talking to somebody the other day who was talking about vaccines, and they were very, very much against doing all the vaccines. And I said, well, you know what, I'd rather be safe than sorry, and I've got the whole list of the ones I do. Real quick, because I don't think we've ever talked about this, but what is the test that people sometimes do to see whether or not their dogs are protected with certain conditions?
It's a titer. And that is a form of serology, like we talked about. So any serology is looking for antibodies. So they take a blood sample from the dog. Let's say they're checking its distemper titer to see if it needs that. And then they run the test and they measure how many antibodies that dog has to distemper.
Okay.
If it's above a certain amount, we know that dog still has protection from the distemper virus. If it's below a certain amount, we know that it's not adequate and it needs boosted.
That's a lot of people do that same thing with children. There's so much discussion, why do I have to do all these vaccines? And people saying, hey, I don't want to do this. You're over-vaccinating my child, or this, and the connections with different diseases and disorders. And I know a lot of people say, even as far as the dogs, so they do this, 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 this. When is it too much? When have I just really stepped outside the boundaries?
Yeah, I mean, I really think it depends on the dog's lifestyle. If your dog isn't going to be around other dogs and at those at-risk things, if they're not going outside and in the woods, then they probably don't need kennel cough, influenza, and Lyme. They just need the core stuff. Maybe your dog is a hunting dog, so it's going to be exposed to lots of ticks, but other than that, it doesn't see any other. It doesn't go to the groomers or anything. Maybe it should have Lyme, but not kennel cough. And those are things that you can really, talk to your veterinarian about and hash out, what do we really, need here? Do we need everything? There's people that say, yeah, my dog doesn't really do any of those things, but I want the extra protection anyway. The core vaccines, really, the rabies and the distemper parvo, any dog should have. Rabies is zoonotic and there's no treatment for it. So that's a human health risk there. So can't budge on that one. And then distemper parvo, we see dogs all the time that don't get the vaccine and they get parvo. It's out out there, and that's very expensive and challenging to treat, and they don't always make it.
Right, so it's not something that the pet owner should say, well, let me see, I've been hearing about all this, so maybe I'm just not going to use the vaccinations against those things. In all honesty, come see any of the vets in the area, and sit down and say, as you see, this is my dog's lifestyle. Does the age of the dog have anything to do with something like this?
Not generally. I mean, they're processing them the same. The only difference with age is sometimes if they're older, we don't have to do like a full series. It's a shorter series because their immune system's a little more competent. But other than that, you know, all the same sort of things apply. Now, we tend to find, you know, maybe as a dog gets older, they say, oh, you know, we used to go to the bark park every week, but, you know, now he's sore and he just doesn't seem to enjoy it like he used to, so we don't really go. Do we still need the kennel cough? Well, if he's not doing any of the other things, you know, probably not.
Right.
So that might change, but it's not, that's again more lifestyle versus specific to just being an older dog.
Right, because I know at the bark park we do require the kennel cough and the Bordetella. We really are adamant about that, even as far as using the laundromat. But I imagine maybe at some point down the road we're going to say, you know what, you ought to consider doing the canine influenza too.
Now that's a good point. So if you look at most of the labels for the kennel cough vaccine, first of all, kennel cough is an umbrella term. It's not a specific disease. It is basically a group of clinical signs that all look the same but are caused by different organisms. So Bordetella is a bacteria that causes that dry barking cough, nasal discharge. Parainfluenza is a virus that causes pretty much the same exact thing, and there's multiple strains of that. So the kennel cough vaccine will not protect the dog from influenza. Parainfluenza, which is in the kennel cough vaccine, is a totally different form of virus than just straight influenza. A lot of people see the parainfluenza there and think, oh, you know, I'm going to Florida, I'm going to board my dog down there. It has that parainfluenza and the kennel cough vaccine. It's not going to provide any coverage. So same with the H3N8, you know, that's protecting against the old strain. A vaccine just came out for the new strain, the H3N2. Just like human flu, it is not going to prevent the dog from getting the virus.
Okay, so I'm coming in next week. I've just noticed on my list of what vaccines my dogs need. They're coming in the end of August, beginning of September, and I think they're due for the canine influenza. Which one should I do?
Well, so
we're going to do both, or are they both together, or if we put them both in the same?
They make a combo, but it's not available right now.
Oh, of course not. Why would it be?
But so what the company is doing, like for us, you know, they gave us the new one, and then they sent some extra of the old one to us. So if people want the protection of both, they can still get that. It's just 2 shots versus 1. So the new vaccine, just like the human flu vaccine, you get it, you can still get the flu, right? It's just not as bad. So it's the same way with the dog flu vaccines.
So I should do both?
It depends on their lifestyle. Now, you're at the bark park all the time. You have dogs coming in from everywhere.
But my dogs basically are in, you know, they don't go down and play with the other dogs.
Yeah. So I think you would just have to flesh out, you know, what's their exposure like. Yeah. Are you, you know, really like scrubbing really good every time you go from the facility, you know, back over? Do you think there's any chance that they could, you know, come in contact with any secretions from any carriers that might be, you know, coming in?
Can I get canine influenza?
No, it is not zoonotic as far as we know.
What's that mean, zoonotic?
Zoonotic is a fancy word for a disease that an animal can transmit to a person.
Such as?
So rabies is zoonotic. Okay. If a cat has rabies and bites you, you can get rabies. Leptospirosis, which we vaccinate for, is zoonotic. If your dog has lepto and it's shedding the urine and you clean up an accident they have in the house and you have a cut on your finger, you could get lepto.
Oh, wow. Do people get that?
Lepto?
Yeah.
Yeah.
Oh my gosh, I've never heard of that.
Okay. So
I thought that was a trick question there.
No. As far as we know, the current, the H3N8 and the H3N2 are both not transmissible to people.
To other species?
So it gets a little muddled. So there's an H3N2 strain that was in Asia last year or earlier this year, I can't quite remember which. And they actually found that some shelter cats did contract that strain. So it's very similar to the one that we have now, but so far in the US there have been no reports from dogs giving it to people or other animals, cats specifically. Now, that's all, you know, everything you read says, well, as far as we know, it can't happen.
As far as we know,
and
sure. That's the cover.
Right, and that's because the flu virus is very good at mutating. That's why every year there has to be a different flu vaccine, because it twists and there's a strain. And that's also why you'll hear about the flu virus jumping from one animal to another. And so we're going to have some big words now. So
okay, I'll get ready.
There's two things mainly that happen. There's antigenic drift, so that's kind of like a little change. Okay?
That's a little word. That's a big word, though.
The drift is a little change, right? So that's when the H3N8 turns into, or you know, shifts just a little bit.
Okay.
Or, you know, so that's a small change. So, you know, it's still within the same species. It's still only doing people, only doing dogs, only doing horses,
okay.
whatever. But it found a little bit of a way to evade the immune system for a little bit longer. The antigenic shift, so like a shift is a lot bigger than a little drift, right? So that's when it goes from, say, being a pig flu virus to now a dog flu virus. So it went from being just in causing problems in one species to now two species.
One is the drift, one is the shift.
Yeah, drift is little, shift is big.
Got it.
So that's where you'll hear about like the bird flu going from birds to people. That's a shift. And that's scary because that means like something radical has changed within that
happened
virus.
over in Asia, didn't it?
Right, right. So that's where things get extra scary. And so that would be a situation where, you know, the dog flu, right now it's just isolated to just to dogs. Whew. If a person gets it, then we know there's been one of those shifts, and that's a big change.
Okay, 5 most important things to remember.
Your dog's lifestyle.
Big. And discuss that with your vet.
Yeah, discuss it with your vet. Can we make that 2?
Okay, that's number 2.
Okay.
Dog lifestyle, you're fudging on me here. Number 2 is discuss it with your vet.
Yeah, whether it's, you know, you don't know what vaccines to do, you don't know, you know, where you should take your dog, what places are safe, or if maybe they have a clinical sign but you're not sure if you can should bring them in. And on that note, if you do bring them in, don't be offended if we ask you to come in through like the side door or something, because it is so contagious. And we do this with kennel cough or parvo or anything else. We typically have them come through another entrance, so they're not sitting up there in the waiting room with all the other dogs, just spreading it. So that's just a little precaution we take.
So if you take care of this dog that has it, and then you take care of this dog that has it, you as a vet could actually transmit it from one to the other. Okay.
So we'll typically have them come in through the side door, we put them in a room, and then we take them out through the side. The doctor will wear like a different smock, same with the technician, and then we disinfect the entire room with one of those appropriate cleaners.
Wow.
And then it pretty much sits there. You know, if they came in at 8:30 in the morning, we won't use that room till like the afternoon.
So our people that are watching need to be aware of the signs, look for the signs. Check and see if something funny is happening. If it is, then check with the vet. And if it gets to that severe stage, man, they better fly to the vet.
If there's a rapid change, don't wait around, you know, just go in right away. Even if it's not flu, let's say that it was a cough that came on quickly because of heart failure. That's not something you want to sit on either, right? So, you know, any rapid progression like that should be a little more cause for concern.
And we also want to suggest to everybody who watches our program that if there's anything else that comes up, that's why we did the tick one. That's why we're doing canine influenza. So if anybody finds anything that they'd like to see us discuss, and I can hammer you about and ask you all those questions, they should either call down here to the veterinarian clinic at Conneaut Lake, or they could call the Bark Park and give us a suggestion, because we would love to do that.
Yeah.
Okay, thank you very much. Really appreciate it. Canine influenza, again, Dr. Consla, thank you. And I will hope to see everybody again sometime. Thank you.